The thoracic limb on the calf specimen, this is the detached left leg, the forelimb. And so we'll be looking at the structures of the intrinsic muscles of the forelimb and also the nerves and vessels. So here on the calf, we are looking at a medial view. You can see this is going to be cranial on this aspect of the limb. This is caudal here. As I turn it and look at the different things in this limb, I'll try and remember to point out which way is cranial and caudal so that you don't get disoriented. Here I've already removed my skin on the distal part of the limb here, so make sure you do that. You're making a medial incision and going around the cannon bone, removing that skin. So I'm going to flip the limb over to the medial side slightly. So here you can see the cephalic vein. This has been cut because you removed it from the body. And so the cephalic vein comes down here. You can see it traveling distally on the limb. Here you see the median cubital vein that goes across medially and kind of dives under the muscle here. So median cubital vein here, cephalic vein continuing down, and then as I turn it a little more medially, you continue to see the cephalic vein here, but we also will see the accessory cephalic vein. So on the calves, it may be a little harder to see things and not cut them. So like I did here, I accidentally cut the accessory cephalic vein and had to suture it back together. But here you should see a small accessory cephalic vein going across the dorsal aspect of the carpus and traveling distally on the limb. Your cephalic vein will continue medially across the medial side here and then travel distally on the medial side. So that's the cephalic vein. Now here we want to look at our pectorals for just a moment. Here I have my deep pectoral muscles, so you want to reflect those to the cranial aspect. So just take the whole thing and reflect it cranially as far as you can, but don't cut it off. So make sure you keep it attached with enough fascia and attachment that it stays on the limb and it doesn't get cut off. And here, I'll put these back together so you can see them. These are our superficial pectoral muscles. So here we have that descending portion of superficial pectoral, and here we have the transverse portion of superficial pectoral. So you want to make one transection down the middle, so just bisect it in half, the transverse part, and then open it up. So reflect both halves, but don't cut them off. Again, you want to keep them attached. So then we can look at the vessels and nerves here on the medial side of the limb. So here on the medial view, we want to take a look at these nerves and vessels in this area. So here is the cranial aspect over here, and here would be caudal on the limb. Dorsal is up this way, and ventral down here. So that hopefully orients you to the specimen here on the table. First, we want to take a look at the axillary artery. So that's the part that was cut away from the body when you remove the limb. So this part is axillary artery here. So axillary then gives rise to the subscapular artery. So this big branch here coming off will be the subscapular artery, and that tends to give off some branches right away. So axillary artery here, subscapular artery there. And then we'll continue to follow this down, and you have a cranial circumflex humeral artery. It's pretty small, but the significance is that after that branch comes off, then the axillary artery changes names. So now it becomes the brachial artery. So here we have brachial artery continuing distally on the limb, down. And so we want to follow that. And as you do so, you'll find a small artery that's called the deep brachial artery. So that'll be a small branch coming off caudally. And then you'll look for the collateral ulnar artery. So it's kind of a small branch as well, but it goes caudally toward the elbow region. So elbows back here would be this one coming back and going along caudally. So it's going to come back towards the elbow. So collateral ulnar artery there. Then continue to follow this distally. So this is still brachial at this point. Continue to follow it along, and as you come down, you're going to look for some branches coming off, but the one in particular you want to see is the common interosseous artery. So that one, you'll want to follow it. It should be a fairly big branch, so it should be this one right here. And that will actually go into the interosseous space in between the radius and the ulna. So if you follow it down and you kind of stick your probe in there, you should be able to feel that that goes in between the bones. So there should be bone on either side of the probe there. So common interosseous artery. So after that common interosseous branch comes off, then this has a name change. The brachial artery now becomes the median artery. So here would be median artery continuing distally down the limb, and median will give off the radial artery. So radial artery is kind of a small branch, and it will continue distally over the carpus. So here would be radial artery. Your median artery will continue and actually dive into the carpal canal. So once it enters that carpal canal, it's called the medial palmar artery. So there's a lot of name changes on this one. But here you have median, and now we'll kind of open this up, and I'll try and pull it out a little bit for you. So you want to cut through the flexor retinaculum. So this really thick fascia here is the flexor retinaculum that's holding the nerves and arteries and tendons all in place. So that flexor retinaculum needs to be cut straight down, and then you open this up and you can actually get into the carpal canal. So here, if we try and pull those vessels out of there, so those are inside the carpal canal. So my finger is in the carpal canal. So we'll pull the vessels out and take a look at the medial palmar artery. So here, I just want to back up a second here. So here you have the median artery. You have this muscle that might be in the way. This is the flexor carpi radialis muscle. So the tendon may be kind of in the way as you trace this artery. But you can kind of move it out of the way, continue to trace the median artery, and then when you go into the carpal canal here at about this point, this will become medial palmar artery. So medial palmar artery will continue distally. Then alongside that, you also have the median nerve. So here, median nerve running alongside that median artery. So in general, in the calf, there's a lot thicker fascia than in the pony. So if you see this, this is really thick and tough. So you have to cut through that to get to all these things. So just make sure you're cutting carefully so you don't cut the nerves and vessels, but do know that it's very thick. All right, we'll back up a little bit and go a little more proximal again to take a look at some of the nerves. So we just talked about that median nerve right here. So running down, median nerve. And then we have musculocutaneous, which is this smaller one that comes off that same trunk as the median, but we'll dive into the muscles. So musculocutaneous nerve here. Median nerve here, continuing down. And then we also have on this calf, there's the ulnar nerve is also tied in with that same trunk as the musculocutaneous and the median. So ulnar nerve here, and that one should be pretty easy to find since it goes caudally towards the elbow joint. So right here, the ulnar nerve. Then we'll move a little more proximally again, and you're looking for a really large nerve, so really big and thick. And that will be your radial nerve. So here, if you just move the vessels out of the way a little bit, and I'll try and elevate this, you can see this really thick nerve here, and it has all of these branches that dive down into the muscles of the triceps. So triceps brachii is this muscle mass back here, and so all these nerves dive in there, and that's the radial nerve. So radial nerve there, and then we also have a suprascapular nerve, and so that one is more proximal yet and is on the cranial aspect of the scapula here. So this one, you may have to cut away some of the subscapularis muscle. So subscapularis muscle here is covering the medial face of the scapula. So that muscle is subscapularis, and you'll have to cut away a little chunk of that to see this suprascapular nerve going across the cranial edge of that scapula. All right, then we also on this view can see the supraspinatus muscle. So here was subscapularis muscle, and then on this cranial edge we see supraspinatus kind of overlapping from the cranial side. So we will turn the specimen over and take a look at some of the muscles on the other side, on the lateral side. So I'm going to flip this over. So here now we are on the lateral side of the specimen. I'm just trying to put some things back in place here. So it would look something like that to start out with. So here would be the cranial aspect. Here is the caudal aspect here on the back side. So we want to make sure that we are identifying things correctly, and it's a little bit harder on the detached limb. So here we have omotransversaris in the calf. Here's that brachiocephalicus muscle. Here's our trapezius. So all of those are kind of stumps that are just hanging out there. So you need to reflect those caudally in order to see that supraspinatus muscle really well. So supra means above, so above the spine on the scapula, so supraspinatus muscle. And then if we flip things the other direction, you'll see this actually is deltoideus. So I'll kind of outline it here for you. But this is deltoideus, and it covers up the infraspinatus muscle, which is underneath. So if you want to reflect that first, then you can see the infraspinatus muscle here. So infra meaning below the spine of the scapula, infraspinatus muscle. And deltoideus in the calf here is covering that up. So make sure you cut that. So cut deltoideus straight across. Reflect that off of infraspinatus, so you'll be able to see that. And that also gives us a nice view of our triceps brachii muscles. So here is that big muscle mass that radial nerve went into, the triceps brachii muscles. And here we have the long head. So long head is very large, long head of the triceps. And here we have the lateral head of the triceps. So the lateral head you want to uncover by reflecting that deltoideus, and then you want to cut it, make a vertical incision through that, and reflect the lateral head of the triceps. And that will enable you to see the brachialis muscle. So L in brachialis is for lateral. It's always on the lateral side of the limb. So brachialis muscle is here. So there's brachialis underneath that lateral head of the triceps muscle. All right, so then we need to flip back over to the medial side for a moment to look at the rest of the triceps muscle. Okay, so now we're back on the medial side where this is going to be cranial and this will be caudal here. And so the triceps, the long head is this big muscle mass here on the caudal aspect. So triceps brachii long head you can see on both sides, medial and lateral. And then we also have this small medial head. We'll kind of dig it out here. So this small part is the medial head of the triceps brachii. From this medial view, we can also see the biceps brachii, which is the muscle that's been cut here, this nice thick muscle belly. So this is biceps brachii. You'll want to look at that and then cut through it and see the central tendon. So the central tendon kind of running in the middle there. And you want to note that that central tendon then travels through and goes to the bicipital tendon, which is this nice big thick tendon on the proximal aspect here. And then it also travels distally, so it will go down. And in the pony, we saw a nice thick lacertus fibrosus that attaches your biceps brachii with your extensor carpi radialis muscle. However, in the calf, there isn't as much there, but this would be what would be called the lacertus fibrosus. So the attachment, the fascial attachment between biceps brachii and your extensor carpi radialis muscle over here. So we'll turn it over just a little bit to see that, extensor carpi radialis. So we'll flip those pectorals out of the way again. And here, on more of a cranial view, you can see the extensor carpi radialis muscle here. And you'll want to follow that, again, cutting through this really thick antebrachial fascia and reflecting that, or just removing it. So here, extensor carpi radialis muscle coming down, follow the tendon across the carpus to where it inserts proximally on the cannon bone. And we'll turn a little bit more to the lateral side, more of that antebrachial fascia there. And we want to take a look at a couple more muscles here. So this one, I'll elevate it with the forceps. This is the Ulnaris lateralis. So on the caudal aspect of the limb, the Ulnaris lateralis, this nice fleshy muscle here, and that inserts on the accessory carpal bone, which you should be able to palpate. So this is a caudal view now. So if you palpate the accessory carpal bone right here, it's on the caudal aspect of the carpus, and you'll have the two muscles that we're talking about inserting on that accessory carpal bone. First one here is the Ulnaris lateralis, and the second one is on the medial side. And that one is right here. And that is the flexor carpi ulnaris muscle. So flexor carpi ulnaris muscle on the medial side, inserting on accessory carpal bone. Ulnaris lateralis on the lateral side, inserting on accessory carpal bone and kind of forming that V shape on the caudal aspect.